My name is Stacey Augustine. I am the Chief Executive Officer of Coffey Health System. One of the most dynamic careers in healthcare today is that of a nurse practitioner. At Coffey Health System, we employ 7 nurse practitioners, and they serve in a variety of capacities throughout our facility. This includes covering in the emergency department, providing primary care services in our rural health clinics, and we even have a nurse practitioner who provides services at the local jail for us. In addition to that, we do have some nurse practitioners that serve in our outpatient specialty clinics as well. I think one of the biggest misconceptions is that nurse practitioners replace physicians, and that's simply not the case. They work together with our physicians. It's a collaborative relationship. The nurse practitioners depend on the physicians, and likewise, the physicians also depend on the nurse practitioners.
I think any student that is thinking of a career in healthcare, that being a nurse practitioner should be a very viable option. It's a very rewarding career, easily obtainable. They can become primary care providers. They can also work alongside physicians. Everything that physicians do except surgical specialties.
When you decide to become a nurse practitioner, you really can follow your passion. And I chose to go into the rural healthcare field because I knew that is where my drive lied. And I knew that I wanted to go into family practice because I could see a really versatile, dynamic amount of patients. My average day is something different every day. I get to see patients from the time that they are born until they're in their older years. And that's the thing that I love the most about being a rural family nurse practitioner, is that I get to see a wide variety of patients. I may see a patient for their diabetes and hypertension, and then the next patient that comes in may be for a well child check. I can do many procedures, whether it is taking care of a wound or taking care of a skin lesion that I'm worried about. And that is why I am so passionate about being in the rural healthcare setting, because of the versatility that it allows me to see, where I'm able to take care of my friends and my neighbors and my community members, the people that really mean the most to me.
I get to start new every day, and I learn something new every day, and I have the opportunity to make an impact in a patient's life and work closely with our EMS and physicians here, other departments, and all of the outside facilities that we transfer to. And I learn every day something new from them, and collaborating and caring for our patients here in Coffey County.
The most traditional pathway to a career as a nurse practitioner begins with a bachelor's degree in nursing, but other undergraduate degrees are accepted with bridge programs available for those outside of nursing. Candidates complete an accredited master's or doctoral program before passing a national certification exam. But your journey can start today.
I knew that I wanted to be in healthcare from a very young age. I remember being 5 years old, and one of our field trips was going to the local hospital. And I knew from that day that I wanted to go into nursing and take care of people as I got older. And as I grew up and I went through high school and through college, this drive to serve others and their health really stayed with me. And so that's when I decided to go to nursing school. And I was a nurse for a couple years before I decided I think I want to go on and do something further. And that's when I chose to go into a family nurse practitioner program that really specialized in the rural settings, because I knew that's where I wanted to end up. If you find that you want to go into the healthcare field, I think it's really important to take those opportunities that are available and go out and job shadow. For me, before I became a nurse practitioner, I looked into physical therapy and occupational therapy and family medicine. But I knew when I shadowed with an advanced nurse practitioner, this was where I needed to be. The wonderful thing about this is that you can go to almost any hospital across the state and ask for their job shadowing opportunities, and they will provide you with that experience so you can find the best fit for you.
Working in a rural environment is a challenge, but it's a challenge that I knew about coming into this, and it's a challenge that I accept every day that I step foot at work. We don't have all of the resources available that you do at an urban setting. You don't have somebody to come in and do every little task for you or assist, but we get to build rapport with patients that are our neighbors or the people we see at the grocery store or go to church with. They have that sigh of relief when you walk in the room and thank you that you are here to take care of them or their child, their mom, their dad, their grandfather. It's something unique that we have the opportunity to be part of their family. We're not just a face that is, somebody that walks in and takes care of them. We're the person that, may have helped their child 10 years ago, or, our children are on the same soccer team, or we saw them at church. We are part of their story every day in the community and at the hospital.